Hi, I'm David from Core Physiotherapy and Pilates Studio. Today we're going to talk about one of the common conditions that we see in our clinics, headaches. There's many types of different headaches, but one of the common ones that we see is the neck-related or cervicogenic headache. Cervicogenic headaches originate from the upper three joints through our neck, so from underneath the skull here, these sort of areas through here. The main causes of cervicogenic headaches are from trauma, so people that have car accidents quite often present post-accident with headaches. Bad posture, particularly for sustained periods of time, whether it be at work or during study, and then from particular injuries, so it may be from a strain in their neck, from whatever that may be. So regardless of the causes, the symptoms of headache are actually quite similar. So today we've got Olivia with us, just to help us demonstrate the areas of where we get headaches. So the common headache symptoms that we get are pain through the base of the skull, either the side of the head, the front of the head, behind the eye, or even around the jaw. You can get symptoms of a neck-related headache. Those symptoms might be just on one side, or they may actually be on both sides. But particularly the one-sided headaches are the ones that we very commonly see with people with a neck-related headache. So it's a very good indicator that their neck should get assessed. The other things that we'll see with people with a neck-related headache are restriction in movement. So things like checking their blind spot may be an issue, or they may just generally feel that their neck is quite stiff mobility-wise. The other thing that we will see people with a neck-related headache is where the doctor's already assessed them and seen that there's nothing else sinister going on, and excluded other sort of causes for the headache. The other things we'll see are just particular problems with posture activities that they're getting their headaches with. So it may be that when they're sitting for long periods, particularly studying or at work, that they're getting their headaches, or during a physical strenuous activity that they're getting their headaches. Yep. So yeah, if you're getting any of those symptoms, then having your neck assessed is a very good start to getting to the bottom of your headaches. So today we're going to just run through a little bit about how we assess people with headaches. So starting off, we tend to talk to them about the history of their headaches, so when they started getting them, how often they get them, how long they last for, what sort of activities tend to provoke their headaches, and get a bit of a picture and a pattern to what's going on with them. And then we do a physical assessment where we go through and look at their posture. So you can see with Olivia, her posture, we're a little bit slouched here. So we'd be looking at whether that's the way that they normally sit, and looking at whether that's a factor in their pain. So we'd look at correcting that posture. So if we get you to sit up nice and tall there, Olivia, and just looking to see whether they can correct that posture actively, or whether there's something structural that may be affecting that. Then we'd have a look at their neck movements. So we'd very simply get them to start with just to look down to start with, looking at the quality of movement, see whether they're moving nicely through the top of their neck, then looking up towards the ceiling there, and again looking to see if they're moving through that upper part of their neck particularly, and then looking forwards. And then we'd have a look at just some turning movements. So again, looking to see what's moving and what's not, and then turning to the other side. Okay. So once we've done all that, we'd then get the client to lie down so that we can actually have a feel of their neck and see what joints are moving, what joints aren't moving, and go from there. So after we've looked at their movement and posture, the next thing we want to do is have a feel for their mobility through each particular joint through their neck. So we're going to start by just basically feeling through, and what we're looking for here is whether we reproduce their headache or whether what we're doing relieves their headache. And that gives us a really good indication that we've basically identified the source of their headache. So we may find one particular joint is stiff or tight through the surrounding muscles, and that it also does bring on their headache pain that they've been suffering. So once we've honed in on that, we can then sort of identify that that's the primary sort of cause of their headache and focus our treatment strategies around that problem. So the initial focus of treatment is on obviously the short term, which is dealing with their headache, and we do that through hands-on treatment. So if we can get Olivia to roll over onto her back there. So the initial focus of treatment is on dealing with the immediate pain of the headache. So we do that through hands-on treatment typically. The treatments that we do are similar to what we're looking at here, where we basically are working on mobilising or reducing the stiffness through those upper three joints through the neck. So that's one of our main sort of focuses is on working on reducing that stiffness and tightness through that part of the neck. We also use some techniques such as massage and trigger points to do that as well. And the aim is really to be able to relieve their headache through that treatment. So after we've dealt with the short-term problem, which is the headache, we then want to look at addressing the factors that started to cause the headache in the first place. So that's going to be looking at addressing their posture, so some exercises to work on correcting that. We're also going to look at some exercise they can do to stretch and relieve the tightness that they get through their neck and maintain the range of motion that they have. Looking at their ergonomic setup, so if they're in an office job or studying, then we want to look at how they're positioning themselves during those activities. If they're having problems with sleep and waking up with headaches, then we also obviously want to have a look at how they're sleeping. So are they sleeping on their side or their back? Do they have enough support from their pillow and bed to support their neck appropriately during those activities? And then hopefully we'll be able to get to the bottom of maintaining them and preventing them from getting headaches into the future. In this video, we've talked about headaches, how we assess and treat them, and some of the strategies used to prevent recurrence. If you suffer from headaches, there's more information on our website, or if you want to have your headaches assessed by a physio, you can call your local core physio practice to book in a time.